Hello and welcome to Skincare Confidential, a podcast supporting the Science of Skincare Summit, which is an annual educational event occurring in Austin. In 2024, it's occurring November 8th through the 10th at the Fairmont Hotel. I am Dr. Ted Lain. I am a co-host and a co-founder of both Skincare Confidential and the Science of Skincare Summit. And along with me, I have
Dr. Patty Farris, board-certified dermatologist, Ted's partner in crime on this podcast, as well as the Science of Skincare Summit, which we're super excited about this year and really excited, I think, in general, that we've been able to get the support of the dermatologic community, the support of industry to really bring forward the science behind topical skincare. So I think it's something Ted and I both have a lot of passion about, and we're really excited. Are we in year 4 or year 5? Time flies when you're having fun. This is year 4.
I know it doesn't stop, does it? So this is year 4 occurring, and we are so lucky in that we're actually bringing the summit to a country outside of the United States this year, aren't we, Patty?
Yeah, that's something we're excited about. I'm not sure we're ready to divulge all of the juicy details about it, but yes, the Science of Skincare Summit is going global this year. So that's super exciting for us.
So more info on that is definitely to come. Well, listen, this is a great opportunity as we hit the new year in 2024, and Happy New Year to everybody listening. We just wanted to kind of take a look back and say, we've had 25 episodes published. This will be number 26.
Wow.
We've spoken to some really amazing people, Patty. I can think of a few that really stick out, but every one of them has brought something really unique to the table. And I'm hoping all of our listeners have thought this was worthwhile, because I certainly learn something every time. Either I listen to an interview from Patty or I have an interview myself. I learn something every single time. It's been wonderful.
I agree. We've been fortunate to have dermatology key opinion leaders join us talking about various aspects of using skincare with their patients, and then all the industry partners who've spoken with us, the Indian chiefs, the scientists, the formulators, everybody who really makes it happen, the innovators, the people who are pushing the envelope in the skincare industry. So if you haven't watched the past 25 episodes, I highly suggest you maybe take a look back at some of those that might be of interest to you, because there's really a lot of good content there.
It's incredible. We've had CEOs of billion-dollar companies. We've had scientists working at the benchtop, formulating new ingredients and formulations, and pretty much everybody in between. So really, we've been so fortunate to gain that kind of traction to allow us to be able to interview such amazing people. So thank you to everybody that's been involved, and certainly we look forward to so much more in the future. Patty and I are both going to be at IMCAS in Paris this month, and so we hope to interview some industry executives and dermatologists from around the world, which will give us now a new global perspective on the skincare industry, right, Patty?
Yes, and I think that it's a great opportunity, that meeting, for anybody who's interested in skincare. They have a really great session on cosmeceuticals and nutraceuticals, which I've been fortunate to be part of. I know Ted has also, but it really is one of the best meetings for content. It certainly has probably the most robust content on topical skincare of any meeting I've been to, with the exception of ours, which is totally dedicated to topical skincare. But some of the things that I think we're interested in looking at is, there's a lot of differences, as you know, Ted, about how things are approached globally. Mm-hmm. One thing that comes to mind with me, I just did an interview with Henry Lim, who's a photobiologist, expert on photoprotection. And, photoprotection around the world is totally different. There's so many filters, UV filters in Europe, that we don't have here in the States. We also have the Food and Drug Administration, who views ingredients for sunscreens as OTC drugs. Mm-hmm. So they have a heavy hand in what happens in our sunscreen market. And that's one of the subjects that's going to be covered at this year's meeting. And I'm excited to hear international speakers discuss the subject of sunscreen ingredients and how we utilize those in our practice, the benefits, the pitfalls, the perils, the safety aspects around them. So it should be a very interesting session.
I think it's also, as we think about skincare around the world, access to it is so different. Where it's sold is so different.
Absolutely.
The expertise is so different in terms of where patients or consumers turn in order to learn which products are right for them. And I think that can really be interesting for our listeners as we try and make that a goal of ours this year, is to really get a more global perspective on the industry. Because when you understand, for example, how someone in France or Spain purchases skincare, it informs, it gives you an idea of how the companies there are developing the skincare products for their consumers. And so many of the companies who are based in Europe or in Asia want to move into the North American market. And sometimes it's difficult because the formulations and the wording on the packages and the packaging themselves is just aberrant for the US market, and they have to really try and formulate and change things up just for what we have here, which I think is really interesting.
Yeah. We've also seen companies try to bring various ingredients into the US market, for
Mm-hmm.
treating whatever, acne, hyperpigmentation,
Right.
any number of things, and how difficult a challenge that can be because of the regulatory environment that we have here. So, hats off to everybody who's innovating, hats off to everybody who's fighting the good fight to keep the
Mm-hmm.
good products in the hands of the dermatologists. And you make a really good point. We as dermatologists in the States enjoy the benefits of being able to direct dispense to our patients and to have products readily available for them to purchase in our office, which is not the case in countries across Europe. It's not the case in places like Brazil. Um, so it makes it very easy for patients to access exactly what their dermatologist wants them to use. Of course, everybody enjoys taking a trip through the French pharmacies and all of
Mm-hmm.
those cool places where they have all the products. I do. I do it every time I go to Europe. It's so much fun.
I do too.
It's sort of an enriched, yeah. I mean, as if we haven't been in enough
Yeah,
places that sell skincare. But we will do that when we get to Paris. I know
that's
we
right.
will,
Every
because they're
time.
so cool. Those pharmacies are just so cutting edge and forward thinking.
Mm-hmm.
Even the one that's in the building that the MCAS lectures will be given in, you're going to be amazed at what a cool pharmacy that is. And it's right on site in that auditorium, right near the auditorium. So they've got us coming and going. They also have shopping in there, which is just bad altogether. Shopping, sales, it's not good it's
Oh
not
boy.
good for the academic environment, but it's a very cool place. And I think, it's interesting, like you said, to think about it. I think if we look back, there's some interesting things that happened this year, but I also think there's some things that maybe we thought would happen but didn't happen. So I'll throw that one to you.
I was really bullish on artificial intelligence really coming into skincare at the point of sale and also at the consumer level at home. And it just hasn't really hit yet in my view. Like, I don't think we've really touched the potential of artificial intelligence or, quite frankly, technology overall for skincare, in particular individualized skincare for the patient. I think certainly there are some great apps that are out there that allow the skin to be scanned, and
Yeah.
using the great cameras and lidar that's in the iPhones, for example, to develop some recommendations is wonderful. But I just don't know that those have been globally accepted or widely utilized. And I think that is something that I really look to for 2024, maybe even beyond, to change how skincare is both sold to the consumer, and how the consumer is able to use their decision making process to purchase the right products for themselves.
Oh, 100% you're going to see that, because a lot of companies that I'm consulting with are very heavily involved in using artificial intelligence. I mean, what comes to mind, one platform that's already out there is Neutrogena 360.
Right.
And you can, scan your face, you can get the product selected by the algorithm. So I'm not sure how widely used those platforms are. There are certainly others, but I think it is the way of the future. I couldn't agree more. A lot of people don't have access to dermatologic care. It's funny because I
Mm-hmm.
just did a post on this for social media because I thought it was it's important for people who can access dermatologists and don't go to estheticians to understand. One thing I don't like that social media has done is promoting the notion that if this is good for me, it's good for everybody.
Yeah.
So I see even our colleagues oftentimes saying, I love this product. I love this product. I've used this and it feels great. And that's all good. But I also think that it's important to understand that individualized skincare is probably the wave of the future. And the companies are looking very strongly at this. And there are a lot of companies who that's their whole platform is individualized skincare. Proven's one that comes to mind. Not that I'm advocating their products, but I thought their concept was so interesting, and they kind of formulate these products based on the answers to the questions that you give to the algorithm, and they create customized serums and products. So it's just sort of an interesting play. But I do believe that that's going to be one of the big things we're going to see. Another thing I saw really popping into social media this year was skincare for preteens.
Yeah.
And since I have several grandchildren who are in that demographic right now, they literally have more skincare on their vanities than I do. They are buying everything. They love Drunk Elephant. They
Right.
love everything that has a kitschy name that looks like a cool color that's popping. They love it. And it's really a challenge to sort of supervise and monitor what these kids are putting on, because we certainly don't need 9-year-olds using retinols, which is
Right.
what I've found on some of my grandkids'
Oh my gosh.
countertops. I'm like, you all didn't even
Yeah.
have pimples yet.
Yeah.
If you get pimples, we could talk about some retinoids. But, that's a very interesting category, and it's huge right now. And there's going to be a lot of innovation, and there's going to be a lot of product lines that are going to target that. Even though we all know there's lots that have been in that demographics for a long time,
Yeah. I mean, pretty much all the sensitive skincare products are aimed at that,
Absolutely. I was
that age
thinking
group already.
Aveeno,
Yeah.
but the Beiersdorf, the Eucerin line has been looking at
Yep.
that, and even Neutrogena with their acne lines, which are so, I think, well formulated and easy to use.
Yep.
But you have to supervise kids that age, just to make sure of what they're buying.
Yeah. Well, A and B, you're gonna we're gonna start seeing some irritants or some true allergic contact dermatitis
For
from
sure.
the 17 products that they're using, which we're taking.
We've already experienced that in
Yeah.
house. Okay.
Yeah.
Like,
Okay.
what?
Gotcha.
Yep, that definitely happens.
Yeah.
But it's an interesting play, and it's an interesting dilemma that puts us in as physicians as to how do we handle kids that age who are interested in skincare. Because certainly nothing wrong with fostering. Could you, wear a sunscreen, wash your face twice a day, wash your face after athletic events. I've always found in practice it's so challenging to get boys to use skincare, and you give them a whole bunch of acne topicals, and their mother comes back. It's like, I'm not buying him anything else. He didn't even use it.
Right.
And so I think fostering good habits in kids that age, there's something to be said for that. If they could just wear sunscreen, maybe a non-comedogenic moisturizer if they want something in the evening, and use a good cleanser, that's a good start.
Yeah. So, I mean, I think that's a really interesting age group to target from the skincare company perspective. I think prejuvenation, maybe a little bit older, early 20s.
Yeah.
I see a lot more on prejuvenation now as well, which I am all for. I think it's a great idea, to really start focusing on the cellular senescence and try and mitigate that as much as possible, maintain your collagen and elastin. Because as we all know, with elastin, you're kind of at your peak at about age 2, and then your elastin quantity decreases throughout your life. So anything you could do early on to maintain your elastin is a great idea. Anything you can do to maintain and continue to build collagen is a great idea. So I really like some of the stuff that these skincare companies are doing for this 20 to 30-year-old age group to really not only foster great sun protective behavior, but also like, look, scientifically, we need to start focusing on the fibroblasts, the melanocytes, the keratinocytes, and how do we do that for your age group so that we're not too aggressive, but we're also making sure that when you do hit your 40s and 50s and 60s, you look like traditionally what someone in their 30s would look like. And I think that's where we're starting to move towards as well.
You just gave me an idea. I'd love to do a talk on prejuvenation and the science behind it.
Yeah.
Because do we really have a lot of science behind prejuvenation? I mean, if you start using a retinoid early, do you have more collagen when you're 50 than you do if you don't? There was one interesting paper that I remember. It was published by Dana Sachs, who was with John Voorhees' lab at the time,
Mm-hmm.
where she looked at a bunch of different ingredients, and it's an old paper, so I can't remember all the specific ingredients. But what she found was that the most important thing that determined whether that ingredient worked, and she did it using skin biopsies for collagen and things like that, was whether the patient started with a deficit to begin with.
Yeah.
So in other words, if you have robust collagen and you're 25, like how much collagen are you going to boost using a peptide, for example?
Right.
That's one of the few papers that I know that has really looked at that. And like, do we even really know that if you use Botox in your 20s, which we both know lots of patients do, are you better off in your 40s? I bet you are, but I'm not sure that we really have the data. We have data to support that.
And those studies would be so difficult. They'd be, studies
Would
that
it be
would
long?
require 20
I know.
years and so expensive. So I think what we do is we kind of rely on the in vitro data and the current clinical data that we have in vivo, and we extrapolate from there. But it would be really interesting just in a case series for a young dermatologist to really start. Usually dermatologists age with their patients, right? So a younger dermatologist tends to have younger patients.
Absolutely.
And if any derm is listening now, it would be a great idea to start taking
Here's
photos.
A good investigator initiated trial for you.
Yeah. Now, maybe not right now, but in about 20 years, if you started taking photos of your patients who came in regularly for Botox
so
in their
cool.
20s, that would be
how did they look? I mean,
it,
it makes total sense. And, sort of the flip side of prejuvenation and preteens is all these menopausal skincare lines we saw launching this year. Yep. At the AAD, I was just in amazement at how many people were focusing on the postmenopausal female and looking at those ingredients. It's just so interesting because a lot of them are sort of the same old, the retinoids, the peptides, which make total sense because here we have women who are at a deficit. They don't have as much collagen as they want or need, but also some innovative ingredients, like the MEP product, the long name of which is escaping me right now, but it's an interesting sort of play on the hormonal deficit that occurs in menopause, and that's the BioPel product,
right?
Emapel. So it's really interesting, and a lot of focus on barrier repair and moisturization, and that group really does present a challenge because they're on the other end of the slope, so to speak. So it's interesting to see major cosmetic companies focusing on them.
And even, as we go down kind of the line of aging, we're even starting to hear more and more about dermatoporosis, which, which is a really interesting term referring to the skin sagging, the easy bruising, the skin tearing that occurs
it's a huge problem.
The epidermis and dermis, we lose the reedy ridges, we lose that kind of ball and claw type relationship, and the epidermis slides on the dermis. And unfortunately that leads to tearing and bruising and kind of what we commonly attribute to senescent skin. And I think we'll start seeing some focus on that age group as well, and trying to maybe not reverse, but ameliorates the effects of dermatoporosis, which is going to be great for our patients. That's an age group, Patty, that just really hasn't been focused on.
You're right. And it's a huge morbidity in older patients, particularly as they get less mobile and they tend to hit things. And, you and I have all dermatologists have dealt with tears and it's a terrible problem in the really older population. Reminds me of that study that you and I were looking at when we were looking at oral collagen and collagen supplements. And somebody actually looked at dermatoporosis and could collagen supplementation help those patients? And unfortunately, the answer was no. Right. Remember, it didn't seem to boost collagen production at all in that patient group. But it doesn't mean that topicals like retinoids or collagen boosting peptides might not be of help. So I think there's a lot more to learn about that and what's going on there. But I think what that showed me, that study, was that normal skin is really different than dermatoporotic skin. Maybe that skin's so far gone because we've certainly seen collagen production and wrinkle effacement with oral collagen supplements in healthy skin.
Yeah, that's a good point.
Yeah, really interesting.
I was thinking about my other life and just the pharmaceutical research that I deal with, and how there's continuing to be this overlap. If we think of like a Venn diagram between pharma and skincare, that overlap in the ovals or the circles continues to progress. And we're going to see more and more pharmaceutical companies touting the beneficial effects of RX products for skin barrier improvement, reduction in transepidermal water loss, maybe even moving into skin quality as well. So, it's just one of the reasons that we started the summit really was because there was so much focus on skincare, both from the skincare companies, but also we were realizing that pharmaceutical companies wanted to get into that arena, at least tout the benefits of their products for skin quality and skin health. And I think this year in particular, we're going to start hearing some of that as pharmaceutical companies have generated that data, are now starting to publish it as well.
Yeah. I mean, that's definitely a benefit they have not touted previously, but that now there's so much focus on barrier and barrier repair, the microbiome. I mean, that's just such a huge category right now. And we're starting to see products really come into the marketplace with microbes, with probiotics in them, with prebiotics that can nurture good bacteria. It's all of it is so intertwined now. We know that, the barrier is not just strictly bricks and mortar, but that the microbiome is a huge part of barrier function, and dysbiosis breaks that apart and causes lots of problems. So things have changed so much. I've been in the business a lot longer than you, but I'm telling you, we never would have even talked about the role of the microbiome in the barrier function, years ago. It wasn't on our radar. It's so fascinating though. I think we've learned a lot on looking at atopics and patients with eczema.
Yep. And psoriasis. And, if we wanted to take that one step further, there's the microbiome of the skin, but there's also the biome of the gut. And that gut skin connection really can affect skin health. I'm hot and heavy about this right now because I'm putting together a lecture on the relationship between rosacea and the gut. And so I'm doing all this research. As you said earlier today, there's nothing that makes you more of an expert than proposing a lecture that was accepted by
by
a conference, and suddenly you got to put it together.
Well, you can reach out to me because I've given that lecture before, and good luck because there's not a lot of studies. There's small intestinal bacterial overgrowth that's been associated with it, but I don't know. I haven't done that talk in a while, but I remember thinking to myself, boy, this is sort of an untouched no-brainer to me. Like somebody just needs to do the study.
Yeah. So there's starting to come out with some basic research on, the effect of regulatory T cells, for example, on skin health that all come from the gut bacteria, and different peptides and small chain fatty acids that are produced by the gut bacteria that lead to some beneficial, but mostly not beneficial effects on the skin, and how that relates both to rosacea, which of course is a disease of the skin, but also to skin health and skin beauty. And so I think we're going to, we've already started to see nutraceuticals creep in more and more into the skin.
Get ready for 2024 because that's going to be another area that I think is just going to explode. And we've already seen big cosmetic companies going into the nutraceutical arena, which shocks me, but pleasantly so, because I think it's such a progressive approach.
Yeah.
And I think we have to be looking at inside out approaches and not just outside in approaches. It's so easy as a dermatologist in a cosmetic company to put things on the skin.
Yeah.
But we have to start getting people to think about the bigger picture and what their gut microbiome is doing and what our horrible Western diet is doing to us in terms of our skin. It's a whole fascinating area that we're going to hear a lot more about. I'm going to throw you one question because I know you know a lot more about senolytics than I do, but we're starting to see some products being advertised all over with ingredients that can affect senolytic cells. So talk about that for just a second.
Yeah, cellulosenescence is really in focus right now because of exosomes primarily, which have come out, but also just some new data that's focused on the effect of the senescent cells and how they lead to aging of the cells near them. And so therefore it tends to be a spiral of senescence or aging of the skin. When you have some senescent cells that cause more cells to become senescent, you get the idea. It's almost like a zombie apocalypse of your skin. So we need to, in some way, focus on either stopping those senescent cells from doing the damage to their healthy neighbors, or just reducing the amount of senescent cells we have in the skin. And so there's senostatics, which are the former, kind of stopping them from affecting other cells, versus senolytics, which are really taking them out of the skin altogether. And it may not be keratinocytes that we're focusing on. There's some data to show melanocytes are the primary culprit in terms of cellular senescence or the aging of the skin. So more to come on that, but you're right. It's interesting. Skincare companies now are focusing on ingredients such as niacinamide, which, we talked about over and over and over. You term it the gentle giant. I love that moniker that you've given it, because it's so true. And, we're learning even more about niacinamide and how it is actually a senolytic. And so, I think companies now are able to do hyaluronic acid might be as well, for example. So some of the tried and true ingredients might have additional benefits that are going to be touted by these skincare companies. And don't discount that if as a consumer, as a dermatologist, or as a skincare professional, because there's some really good data to show that, at least in vitro, that these tried and true ingredients may actually work against cellular senescence. So more to come on that. And then, of course, new ingredients as well will be coming out. But I think, look, we've just given a great 360 of the what we did in 2023 and what's coming in 2024. I think you and I are really jazzed up about what we can offer with Skincare Confidential for at least the next 12 months. And I think well beyond that, given everything we just talked about. And again, I just want to thank, on behalf of Patty and myself, thank you to all our listeners or subscribers. Thank you for all the downloads and support. Can't tell you how often Patty and I both get emails or just quick comments about how much this podcast is appreciated. So, this is a passion project of ours, right, Patty? We enjoy this more than anybody.
Yeah, it's so much fun. And for anybody who's really wants to learn more about skincare, please join us at this year's summit. Again, Austin, Texas, November 8th through the 10th. It's also one of the best parties, in my opinion. We have a really good time. We have a lot of, let's just say, interesting social events that I think people really enjoy. So if you've never been to Austin, it's a cool spot to do things like that. So we take full advantage, right, Ted? Ted's hometown.
There you go. So listen, if you have any ideas for future episodes, or if you have any questions about an episode, you can email us at inquiry@scienceofskincaresummit.com. That's inquiry@scienceofskincaresummit.com. You can learn more about the summit at scienceofskincaresummit.com as well. And then, we look forward to more and more episodes, and please give us a shout if you need anything from us, if you'd like to learn anything more about any of the episodes, or if you have an idea for an episode, we'd love to hear from you. And thank you again for your support, everybody out there. I'm Dr. Ted Lain in Austin, and I'm with Dr. Patty Farris in New Orleans, and we are the co-hosts of Skincare Confidential. Thank you very much.